How to treat lumps and bumps from under the eyes. Hi, my name is Dr. Davin Lim, board certified laser dermatologist. Today we'll be talking about how to treat lumps and bumps under the eyes. The most important thing is a diagnosis. And people get confused between Millia and syringomas. Millia are very common. These are usually smaller and they lie on the surface of the skin and they're super easy to remove. I'll do a video on how to remove Millia at a later stage. Today we'll be talking about syringomas and what they are and my methods of how I remove them. Syringomas can be treated using several methods, including cautery, TCA peels, and of course laser. I'll go through my method of how I treat the vast majority of syringomas, which is basically laser treatment. So stay tuned and I'll show you how it's done. Thanks for that. Okay guys, so here are the fundamental differences. Syringomas lie deep in the skin. They are genetic in origin and often more common in Asians. They occur usually in the lower eyelids, but in extensive cases they can occur both in the upper and lower eyelids. And they arise from sweat gland ducts. Millia are very, very common. They lie on the surface of the skin and they're super easy to remove. In fact, they're so easy to remove, I'll do a little video on just using a simple needle to remove Millia. So how do we remove syringomas? I like using CO2 or erbium lasers for syringomas. These are reliable and basically scar-free technique of how I use to remove syringomas. So you can see me using an erbium laser this time, and I'm tapping into the skin. So it's 2 taps, and that usually gets me double into the skin layer, and I often go about 4 or 5 times the depth of the skin to remove these syringomas. It's a painless procedure because it's conducted under sedation, numbing cream, and injections. So how long does the procedure take? Well, it depends on the number of syringomas, anywhere between 5 minutes all the way up to 15 to 20 minutes. Sometimes I blend the surrounding skin, and yeah, it really depends on the depth of the syringomas. Some of them lie superficial and they're really easy to remove, and the ones that lie really deep just take me that little bit longer. So I'm using an erbium laser, but like I said, I also use a CO2 laser for this as well. Following syringoma removal, the skin often takes between 5 to 8 days for it to heal up completely. In darker skin type like Asians, you often get skin color changes for a couple of weeks, sometimes even months, depending on the depth. But overall, an excellent procedure with very little risk involved. So what are the before and afters like? So these are the typical before and afters. Remember, we're looking at reduction of and not absolute removal. These do recur over time, and sometimes these processes need to be repeated once every few years. Thanks for watching, and remember to subscribe for more info on anything laser and aesthetic dermatology related. So please guys, if you have any questions, just leave them on the section below and I'll answer them. I'm glad to do that, and really appreciate your support, especially from all you guys in the US. Thanks for that.